finished what is a complete 100% total capsule removal on a lady that had a ruptured implant. So her saline implant from 2007 collapsed on itself. And then she went to a plastic surgeon who then purposefully, deliberately punctured the other side in order to make it more symmetric to the other side and basically release the contents without any surgery, just poked with a needle, which is an absolute no-no. Because what happens is now that saline that's inside the saline implant is going to eventually leak out, even though the surgeon may pull most of it out. And then you're left with the same problem where you have that implant and that capsule, and then you have that residual saline, as you will see on the inside, that continues to be a problem for the patient afterwards. And she had the many symptoms of breast implant illness, and she comes to me for removal of the implant capsule, all inflamed tissue. And as you will see over here, this is on the right side. I cut out the excess skin. She had, relatively speaking, large implants, and as you will see, the entire implant capsule was removed. You can see there's a lot of redundancy of the capsule. If I pull this up, you can see. The other thing is, as we saw earlier, you can see the pointed nature of that implant. Sometimes the patients can feel it because this protrudes out and feels uncomfortable, and the irregularities. So what I'm going to do next is I'm going to go ahead and cut this ruptured right saline implant open, that capsule, excuse me, and you will see how it is, quote, if you will, innocently sitting, but very much the culprit behind her many symptoms. Look at the way as I pull it out, how it has literally triangulated, and I'm going to just put it out here. I just did not open it. This is how it was, and how it completely collapsed on itself. And this was a very large implant because the area, the diameter of the implant on which the right side of the chestis was sitting on. So as I open this up, you will see the quote, the way the implant collapses on itself. So as I go in, this is your 550 Megan, 550 Megan saline implant. You can see right here some of this uh, fragments that have formed around this. And if I go like this around, remember my gloves were new. If I go around like this sliminess around, look at this. This is as if I showed you this, you would say, oh, it's probably dealing with a ruptured implant. No, this is a ruptured saline implant, and this is that silicone that is leached out from the silicone shell of the saline implant. Look at this. And this is what we have seen many times with the ruptured silicone implant. So completely removed. Let's go ahead and look at the inside. Look at this. Some areas so thin, some areas thick, and overall, I'm very happy. Look at this. How complete removal of the entire implant capsule has been done. There's no extra fluid or anything on the inside. So if I go like this, you can see this is that gel bleed that's occurring from here. I'm going to remove my top glove, and then we're going to focus onto the left side. There's no such thing as safe implants. As you can see, look at the destructive nature of these implants. Again, look at the way it is protruding out, and the way this has folded up on itself. A lot of, as it collapses, the capsule is all taken off. I don't want to remove piece by piece, because what if there is, you want to remove the whole capsule as one unit. That's the etiquette of doing, even with the ruptured saline implant, the right surgery. So as I go in, as you will see, uh, look at the way the implant is sitting, and I'm going to just literally remove it. Again, it has triangulated. This is exactly how it was sitting on the patient. And I'm going to unfold here. It's like opening up a gift, if you will. Opening up thus. And you can see right here, this is your, I'm going to send this off with pathology right here. So this is your, and I'm going to, this is your 550 Megan saline ruptured. So if I go like this around, that fluid around, and I go, look at this. This is your ruptured saline implant. And again, it is not healthy, it's not safe, it's not wise to rupture an implant. It does not sound right to begin with. And you can see a much smaller capsule on this side. And again, the capsule is so thin. Look at my glove. If I put this ruler here, you can see, you can actually read 927, the writing on the back. No matter how thin the capsule is, it must be removed because the patient is not going to bounce back, and complete removal of the entire implant capsule is done such that there is no inflammatory burden left behind. So I'm very happy and content. I'm just going to invert this so we can take some better pictures. So the implants will be returned to the patient. The capsules will be sent to pathology, rule out the BIA, ALCL, CD30 analysis, rule out lymphoma, rule out malignancy, rule out any abnormal pathology, cultures for bacteria, aerobic, anaerobic, and fungal. And as the patient will heal, she will have complete freedom in her mind that all of that capsular burden, implant, and tissue was removed. She has no capsular burden left behind. She will have hopefully only good health ahead of her, minus the many symptoms of breast implant illness. Remember, if this was even the many, many, many ruptured silicone implants that I have done, everything needs to be contained. All the capsular tissue needs to be removed such that we don't have to deal with anything afterwards. And anything even remotely suspicious is removed such that the entire implant capsule, all the inflamed tissue is removed completely, sincerely, definitively. And tonight, when this patient sleeps, she'll have that peace of mind, that freedom, that she has had all of that toxic burden removed from her body. This is Dr. Khan, Executive Plastic Surgery.